Welcome everybody to the workshop tonight. We're talking about a topic that is somewhat isolated. Obviously, not everybody has small kids that are in the category of having to worry about ear infections, but nonetheless, it's an important topic because it's especially when you look at the amount of money that goes into treating ear infections every year, it's enormous. Okay, this is a giant problem. This is probably the most common health problem with kids, in those younger years, so it's something that we need to get the information out and, get as many informed as possible. And so that's the whole purpose in this workshop tonight. The topic is informed or overtreated, because really what it comes down to is, unfortunately, in this day and age, you are either informed or you're overtreated. There's not a lot of middle ground in between. I will tell you, and this is just after 15 years in practice, this is the truth. The most overdiagnosed thing with kids that I see in practice in real everyday life is ear infections. I can't tell you the number of times that over the years I've had parents come in and said, that the kid was diagnosed with an ear infection, or the kid was diagnosed with a double ear infection, and they're always given antibiotics. And I look at them and I'm like, no, I don't think there's an ear infection here. And what it comes down to is that I would always look in the kid's ears, and it would basically be my word against the pediatrician, right? So who's going to win that, right? It used to be, the pediatrician was going to take it because, they're a pediatrician, right? They're an MD. They only see kids all day long, every day, so obviously, they're the ones that really know what they're doing. Even though I'm looking with my otoscope in the child's ears and there's nothing. There's like little pieces of wax, but that's it. But it really actually turned out kind of cool, because then they came out with stuff like this, okay? This is an iPhone otoscope, okay? And this was a game changer, because for the first time, I could take actual video of the child's ear and review it immediately with the parent. So for the first time, parents were able to actually see in the ear what we're seeing. Now there's no question, right? Now you can actually see it, and seeing is believing. So when we look in an ear and I point out, do you see that? Do you see that? You see that little piece of wax, but you don't see any blood vessels, you don't see anything, there's nothing there. Everything's clear. Then all of a sudden the conversation changed. And there's other ones on the market now. This is one that I bought from China that did not work. This is a long cord endoscope, and the idea was that we could actually even look in our own ears, right? So you could take this and you could look in here, and you could be on your phone actually watching what you're looking at. But unfortunately, I couldn't see squat with it, and I even messaged the company. I was like, it's no good. You might be able to see an image of something, but it's so blurry you can't tell what it is. So that was junk. But there's all kinds of the point is you can get devices like this on Amazon. You can there's lots of options available now. So pretty much any parent with small kids can get one of these, and this is almost the equivalent of, and I think it should be the equivalent of having a thermometer at home, right? You probably have a thermometer somewhere in the house for the kids, okay? And so when, we've got the little forehead ones that you run across the forehead and it automatically beeps. They're awesome, but it's just standard fare. This kind of thing should be standard fare if your kids are at the age of ear infections, and especially if they've had one. Because what you're going to spend on one of these, that actually works. But what you're going to spend on one that actually works is far less than what you're going to spend on a kid with ear infections, okay? Especially if you look at some of the tragic instances that we've seen over time. I know you had one of those, and so, the bottom line is we've got to change the way that things are treated, because it's, when you consistently see something being over described and then over prescribed, then it's a whole lot of waste. Okay, and that is it. I mean, that costs everybody everything, but of course it just continues to drive doctor profits too. So, you know, you can see there's not going to be a lot of effort to change that. So hopefully this information reaches some people today to where you don't have to just walk down that path. Okay. All right. So what are the symptoms of an ear infection? I want to talk about symptoms for a second on the front side of it, because here's a reality. Just because you have the symptoms doesn't mean you have the problem, right? You know, anybody that goes through nursing school or goes through med school or anything, you sit there and you hear certain symptoms of things and you're like, oh my gosh, I think I have that, right? That's like, you know, that's a pretty common thing. But that's because so many symptoms describe so many different things, but they don't necessarily add up to what the actual problem is. Okay, so just because your kid is crying and pulling on his ear does not mean that he has an ear infection. He, she doesn't matter. Okay, let me propose this. It might just be because, one, babies cry, and two, they've got this thing on the side of their head, and it just happens to be played with, right? That happens a lot. Okay, just because they mess with it does not mean that it's bothering them. You know, so if you look and you don't see any discharge around the ear, you don't see anything else at all, they're not snotty, it doesn't immediately mean that they have an ear infection just because they're tugging on their ear. Now that sounds elementary, but I'm telling you, I've seen that numerous times where it's, well, you know, they're pulling on their ear, so, you know, I brought them to the doctor and they said, yep, they got an ear infection. I'm looking at the kid and I'm like, there is nothing wrong with this kid. They don't have even the slightest sniffle, and yet they were diagnosed with a double ear infection. I look in there and there's nothing. The kid is perfectly fine. I had a patient who was, I don't know what the exact title was, but that's all she does all day long is look in ears. She was some kind of a tech. I don't know what business she worked in or whatever, but that's all she does is look in ears. And when I found out what she did, you know, we're in her new patient appointment, and I'm like, okay, hang on a second. You got to tell me, is this what you see? And she literally rolled her eyes and threw her head back, and she's like, oh my gosh, let me tell you, I cannot agree with you more. Doctors constantly, we have patients coming in saying that they had that they were diagnosed with an ear infection, and there's nothing there. We look in there and there's absolutely nothing there. It happens all the time. So just because you have these symptoms doesn't mean that there's an ear infection there. Okay. It may have ear pain, maybe more when lying down, okay, so, but you know that's really hard to describe or tell the difference because kids cry, you know, and they cry for all kinds of reasons. There's tugging on the ear, you know, if they have a lot of discharge and everything coming out their ear and they're tugging on their ear and sticking their finger in their ear and stuff like that, then yeah, you know, there might be an issue, but just because they happen to grab it here and there, that doesn't necessarily mean that. Okay, difficulty sleeping, crying or irritable more than usual, less responsive to sounds and talking. So if you just can't get their attention, loss of balance, which would imply an actual pressure issue with the inner ear. That's probably a more likely symptom. Fever, you know, which it would imply that there is an actual infection going on. Ear drainage, headache, loss of appetite, and some of these you can see they're very difficult to even figure out with a small child because they can't communicate these things to you. Okay, so it really comes down to you've got to be able to match the symptoms, but look and you can see. I mean, that's the funny thing. This is like looking at a skin infection. You look at the skin and you know it's there. You look in the ear and you know it's there. The reason why there's so much discrepancy is because before stuff like this came along, how many parents have an otoscope sitting at home and know how to use it? Nobody. So it came down to a doctor looking in someone's ear and being able to tell you whatever, because it doesn't matter. You're not going to be able to verify it. Okay, so they give you an antibiotic now as a precaution because really, you know, well, you know, I think there might be an infection there. We're going to give you an antibiotic as a precaution. You know, or yes, we're going to give you an antibiotic because there's definitely an ear infection. When they may know there's not an ear infection there, but who would know? Because you can't actually look yourself, but now you can. And that validation on your own part is important. Okay, so this is what a normal eardrum looks like. The tympanic membrane should have a translucent, pearly gray appearance. Okay, so basically you can see it. It's like cloudy glass, but you can see back behind it, as opposed to a thick, very, very cloudy white. You normally see a cone of light. That's a reflection of what you're using to look in the ear, right? So you're going to have a light source, or otherwise you can't see in a dark tunnel. So you're going to see that reflection off the shine of the eardrum. You got normal is cerumen, earwax. It's normal unless it includes view of more than 50% of the membrane. Some people have genetically really clean ears. They just don't produce much wax at all. Others, like me, produce tons. My family, my dad, myself, my kids tend to produce earwax like crazy, and so we have to clean our ears out, so I look in other people's ears and, they're like, oh, well, I've had employees ask, hey, look at mine and see what's in there. And I look in there and I'm like, how often do you clean your ears? And, oh, I never do. There's like nothing in there. It looks like you could, it's just, there's nothing in there. There's no wax. I was going to say eat off of it. That's disgusting. So unless it includes more than 50% of the membrane, then you're good. But, even when it does cover the eardrum, you can still hear. I can tell you that now. It's crazy, once you do get a lot of wax out and you really clean it out, how much better you can hear. Because one time I had to clean my ears out for a long time, and I had a lot of buildup in there. And, I was not hearing quite as well. But, I could still hear. I can still listen to music and have conversations and everything, and nobody would ever know. But once I cleaned my ears out completely, oh my gosh. It was like I could hear a pin drop across the room. Like people talking in the same room, I was like wanting to cover my ears. Like, this is maybe too much information, but going to the restroom sounded like breaking glass in the water. Like, it was awful. And it took a few days for everything to kind of level out, because your brain will rewire the input that's coming in and normalize it. So just like that, your brain will essentially amplify your hearing to be able to hear even when you do have buildup. So, it's just very fascinating how the body uses the senses, just like, eyesight and touch and everything else. It can adapt to these changes. But earwax is a normal thing. That does not mean that you have an ear infection because you have wax in the ear. Whether it's yellow or brown, it doesn't matter. But all the time, I look in kids' ears and there's a lot of wax in there, but there's no infection. You can see the eardrum clearly. You can see, on this picture, you can see very tiny blood vessels, but hardly anything. No redness around the edge, no swelling of the tympanic membrane, anything like that. So what does a ear infection look like? Okay, it's more like this. And these are pretty bad ones, but you can see the bulging of the eardrum. Okay, it's literally got fluid back behind it. You see how that's that cloudy white? Okay, it's not translucent anymore because it's got fluid packed up behind it. One of the biggest signs is you're going to see this dilation of the blood vessels. Okay, and it doesn't have to be everywhere like this. This is a pissed off ear. Okay, I've seen ones where yes, there was an infection where you see an area like this that's red. But the rest of it is fine. But there's definitely dilation of the blood vessels because the body is trying to deal with that infection. It's trying to have it's increasing vascularity to that area to bring what? White blood cells. Okay, it's activating the immune system. Okay, you can still see the bone, the malleus here, but not very well. But that is an ear infection. There's no mistaking it. This one here, a little bit less red, but you can still see all the vascularity across the tympanic membrane. You can see the thickening and the bulging. You can see this purulent material behind the eardrum. Same thing here, thickened eardrum, the blood vessels. This is one that has tubes in there. Okay, so this is a chronic case where they had tubes inserted in But look at this. I mean, everything is just growing around the tube. And this is a ticked off angry ear. So, these aren't, they're not easily mistaken. I mean, when there's an infection or not. Just like if you look at your arm and you can tell if there's an infection or not. It's not hard to identify, but it is hard when you can't, when you're not the one looking in the ear, when you're just having to take someone's word at it. Okay, so what are the causes? An ear infection is caused by a bacterium or virus in the middle ear. This infection often results from another illness, cold, flu, or allergy that cause congestion and swelling of the nasal passages, throat, and the eustachian tubes. That's according to the Mayo Clinic. So, of course, the eustachian tube connects up through the back of the sinuses and goes in, and then you've got the passage to the ear. So the membrane separates the two, and you can get mucus and drainage that basically backs up into here. Okay, so the eustachian tubes connect high in the back of the throat and can clog various ways. They are narrower and more horizontal in children. Okay, this is all mechanics. So as you grow, of course, everything becomes more vertical. All your passageways expand, just like your arm and your head expands, right? So everything gets bigger. But when you're a little kid, those passageways are tiny. So they don't have a lot of space for stuff to drain properly. So that's why they tend to get more backed up. But you're usually going to see an ear infection be preceded by a cold or flu or something else like that. They're going to be snotty, and runny nose and all that kind of stuff. That's usually what precedes it. It's not, the infection going from the outside in typically, unless it's swimmer's ear or something of that nature. Okay. Now, this is interesting. Most ear infections host both bacteria and viruses. Bacteria in 92% of cases, viruses in 70% of cases, and both in 66%. Okay? So this is, of course, research, scientific research, because, we want to make sure that we're science-based, right, and evidence-based, in our discussion. But let me propose a different thought to you. Is it really surprising that there's both bacteria and viruses when they look in that fluid? Is that necessarily the reason why you're having these symptoms, just because there's the presence of bacteria and viruses in there? Now I propose no, because there's basically bacteria and viruses in everything. It doesn't matter. So just because you have bacteria in fluid that's in your ears doesn't mean that you're going to have an ear infection. Okay? So the presence of bacteria is normal. And we have to make that delineation and clarify that and really rewire the way that we've been trained and the way that we think, because we automatically assume the presence of bacteria is bad, right? That's the way we're taught. The presence of bacteria is bad in everything. It's BS. There's bacteria and viruses present everywhere all the time. You're full of them, you're full of them, you're full of them, everybody's full of them. I mean, it's just, you're made up of a microbiome and a microbiome. I mean, that is a major component of your body, so of course they're everywhere. So just because you have bacteria or viruses doesn't mean that there's a problem. Okay, and so, when we look at studies like this, it's like, okay, yeah, of course, there's bacteria present. So is that validation, though, to give antibiotics in 92% of cases, or rather the standard in 100% of cases, just make sure you catch 92? No. Because just the presence of bacteria alone doesn't mean that you need antibiotics, or else all of us would be living on antibiotics all the time. And it's absurd. Okay? So, complications. Rupture of the eardrum is most often the warning by pediatricians. So they say that if you don't, deal with the infection, well, then the eardrum could rupture, right? And that would be bad. But think about the irony here, that the cure is to do what? Rupture the eardrum and stick a tube in there. Does anybody else? I mean, that doesn't add up. Like, you're worried about rupturing the eardrum, so you're going to rupture the eardrum. But, we do it surgically. We're in control of it. It's the same thing. But it's even worse because now you have a foreign object implanted in your head, in your child's head, right? It's just absurd. Most eardrum, this makes it worse. Most eardrum tears heal within 72 hours and rarely require surgical repair. So even if you do get so much pressure that it perforates and it busts a little bit, most likely it's going to heal on its own in 3 days, right? It's unbelievable. Though hearing loss is often feared, it's rarely seen. Think about the severity of an infection it would require to actually destroy the physical structures of the ear. How long a raging infection would have to stay put before it would actually damage and be able to chew away and eat away at bones, the malleus, these other bones in the ear. I mean, that's not something that happens easily. Okay, so it's just like that. That's like saying that if you get a infection on your finger, well then you're gonna lose your finger. Really? Because I've had plenty of infections on my finger and it's still here. It happens. It's not that big a deal. It takes a lot of time for physical structures to be damaged and severely injured to the point where you be deaf. So a lot of this stuff is just fear talk. That's the bottom line. It's just fear talk. All right. So what are the treatments? The American Academy of Pediatrics and the American Academy of Family Physicians, those are both medical organizations, both recommend a wait-and-see approach for the following. They say wait and see, don't do anything. Children 6 to 23 months with mild inner ear pain in one ear for less than 48 hours and a temperature of less than 102.2. Okay? Then children 24 months and older with mild inner ear pain in one or both ears for less than 48 hours and temp less than 102.2. Now, do you think those standards are followed commonly? Do you think it's the norm to follow those standards? No, it's not. Nope. I mean, they have them there, but, one rationale would be, well, it's been 49 hours, so, we should probably go ahead and treat her. Well, the temperature is 102.6, so I guess we should go ahead and treat. They have these standards in place, but, even if that would be a good rationale, that's not what's actually happening. I can tell you, most of the time it's just treat regardless. It's antibiotics regardless. It doesn't even matter. If they even think that there's an infection there, they're going to give you antibiotics. They admit symptoms usually improve within the first couple of days, and most ear infections clear up on their own within 1 to 2 weeks without any treatment. Okay? So go back to that there. It says less than 48 hours. Okay, so don't treat it if it's been less than 48 hours. Yet they admit right there that most recover on their own in 1 to 2 weeks without any treatment whatsoever. So even the standards don't make any sense according to what's actually going on. Right? It's just an infection. If you get a cut on your leg, anybody ever get a little cut on their leg? And it might look a little bit nappy for a couple of days, but usually what happens, it just clears up perfectly fine. How often does it actually turn into a staph infection or something like that? Not very often. And that's if you don't do anything. Now, most people, they will do something. They'll put Neosporin on it, or they'll use silver, or something like that, as we would recommend, use silver and clear it up and you don't have to worry about it. But anyhow, for every 100 otherwise healthy children with uncomplicated middle ear infections, about 80 could be expected to improve without antibiotics within about 3 days. Okay? Out of 100, 80 will improve. That's 80% will improve doing absolutely nothing. Okay? However, 3 to 10 would develop a rash, and 5 to 10 would get diarrhea if treated with antibiotics. Okay, so if you give those same 100 antibiotics, 80 of them would have gotten better on their own anyways, but up to 20 of them would develop a side effect of the antibiotics. So you're really trading off, symptoms for, or side effects rather, for something that would otherwise clear up on its own. Okay? That was according to the Journal of the American Medical Association 2010. Okay? A 2006 government survey found the average, and I want to point this out unabashedly, that I think this is the real driver behind the entire thing. This 2006 government survey found the average cost for treating ear infections to be $350 per child, totaling $2.8 billion per year that we're spending in this country on ear infections that most would otherwise clear up on their own. So, do you think there's an incentive to treat an ear infection if you're paid $350 per child to do so? I mean, this is a capitalist society, so the assumption would be yes, right? You know, that they're going to have, I mean, if they're making money for treating it, you can see why they're treating it. Instead of just saying, oh, no, don't even bother coming in, you know, with little Jimmy, you know, because it's going to clear up on its own. You know, and imagine getting phone calls all day long. You know, you get 15 phone calls a day from a parent wanting to schedule an appointment for an ear infection, and your receptionist is turning away all 15 of them and saying, why don't you wait for 2 weeks, and if something serious happens, call us back. Do you think they've been employed there very long? Not at all, right? So now, to go even further on this, you know, we see all these images all the time put all over the media as far as, you know, what measles looks like. You guys are seeing that all over the place right now, and how devastating measles is, and how, you know, we just, you know, these unvaccinated people don't get it, you know, because measles is a devastating disease, you know, that causes awful rashes and stuff, right? You know, and that's about the extent of it, you know, that we should feel awful because of that, because we don't understand the gravity of it, okay? This is an antibiotic reaction. This is from giving antibiotics for things like ear infections. That looks far worse than measles. And it's actually far more dangerous than measles also. Do you hear anything about that on the media? Yeah. When was the last time you heard a story about the devastating side effects of overprescribing antibiotics? You don't, you won't. Okay, but this is the truth of what's going on. Your kid could come home and develop this for something that otherwise they would have no issue whatsoever. You know, kind of like having a vaccine reaction as a trade-off for getting polio, which is never going to happen. So, you know, we've got to start thinking about this stuff outside the box, because there is a driver here, and it's called profits. Okay? Contraindications. Billions of dollars are spent in the U.S. for diagnosing and treating fluid in the ear each year. However, the fluid most often disappears of its own accord and does not lead to acute ear infections. Also, antihistamines and antibiotics have little effect on the condition and do not help prevent delays in learning or language and speech development. So, again, this is out of Harvard Medical School. Roughly 80% of children with acute ear infections get better without antibiotic treatment. So 80% are going to get better, but probably 95% of them get prescriptions for antibiotics and get treated otherwise. That's unfortunately just how it is. And it doesn't always just end there. So ear tubes, commonly done. You guys all know somebody that has had ear tubes. Everybody does, because it's that common. If 3 episodes of infection in 6 months or 4 episodes in a year with at least 1 occurring in the past 6 months, then ear tubes are often recommended. That's the guideline. Of course, it probably even goes, once again, beyond that. You know, this is the guideline, but I'm sure there's plenty of extra instances where, you know, it's called for, even though they haven't met this criteria. But the tubes, of course, do nothing to address the actual cause of the fluid. They only drain it, and themselves arguably can cause long-term damage because you're perforating the eardrum. And the more that you do them, the more scarring and permanent damage you're doing to the eardrum. But the biggest issue is, once again, I'm going to repeat, it does not affect the cause. It doesn't do anything to affect the cause. All it does is allow the fluid behind the ear to drain out. The question is, well, why is it doing that anyways? I guarantee you that kid with the ear tubes in his ear, he's every bit as snotty. He's got all the same drainage, and just because he's not now screaming with pressure behind his ears, you know, the parents aren't going to know to do anything. So they're not going to change his diet. They're not going to change, you know, the allergy to pets, you know, or the nasty carpet that they've got in their house, or all these other factors that could be leading into it. They don't address those things. And so the actual problem person, you this is a surgery, and you've got to think, this is your kid getting put to sleep with anesthesia, okay, which has been linked to cancer and is not in itself entirely safe, and they're doing this surgery that the kid now has to recover from for something that, otherwise needs to be dealt with at the cause, not the symptom, in pretty much every case, okay? And it doesn't always stop there, too. How often are adenoids removed? Adenoids are high in the back of the nose, meaning inflammation or enlargement may block the tubes. So if swelling or infection is the secondary result of something else, removal certainly won't solve the actual problem. So why are the adenoids swollen? Why are the tonsils swollen? Why is a kid having this over-immune response and getting these infections? None of that is being addressed. Maybe it's a milk allergy. Maybe it's overconsumption of sugar. It could be all kinds of other things. Maybe it's because they had too many antibiotics and now their body's resistant to them, and it's not able to really catch up on things. There's all these factors that come into play that never get looked at because it's just one medical procedure after another after another. All right. Other factors, babies who drink from a bottle, especially while lying down, have greater tendency for ear infections than breastfed babies. This probably has absolutely nothing to do, or relatively nothing to do, with the fact that they're actually drinking from a bottle, and more to do with the fact that they're not actually getting real food. They're not getting the immune factors that the mother naturally produces and readjusts all the time. You know that every time that you nurse a baby, your body identifies somehow, there's some kind of a connection there, and actually will reconstitute the milk for what the baby needs. Can you get that out of a can? No, you can't. So that's probably more to do with what's going on there, and that's why you see all of these studies coming out that have all these different benefits to breastfeeding, and there's pretty much none in the lean towards formula. Also, poor air quality increases the risk. Why? Because if your kid, if the parents are smoking in the house or have, 16 dogs in the house that has all this dander and everything, the air quality in the house sucks, or mold in the rooms, things like that, then what's going to happen? You're going to have sinus infections, you're going to have drainage, you're going to have runny nose and histamine responses, and that's going to increase your risk. So, but ear tubes don't solve those things. The only thing that solves those things is fixing the cause. Okay, that's where we should be focusing on, but there's not a lot of money in that, so you can see why. The chiropractic approach, adjustment helps through a multitude of factors, but it includes stimulating the immune system and mechanically affecting the ear canal. As we said, that ear canal is tiny, so even the smallest adjustments in the physical positioning of the vertebrae in the upper neck in relationship to the skull is going to make an impact. So the mechanically affecting the ear canal via soft tissue affects the vertebral and skull alignment. The biggest thing, what are the side effects? Of getting a kid adjusted that has an ear infection, what are the side effects? I've been in practice for 15 years. I've never seen any. I can't say that there aren't any. I suppose if you rotate a kid's head all the way around backwards, bad things are going to happen. I don't think anybody has a question about that. But that really should not happen. And there's some adjusting methods that I learned, especially online. Oh my gosh, watching, even looking for pictures and stuff of kids getting adjusted. I can't, you look up child adjustment, and the vast majority of the pictures online are these little kids, and they're laying face down on a table with the doctor on top of them, crunching their back face down. I'm stepping on toes here, but guess what, chiropractors? You're flattening out a kid's developing spine. There's these things, these natural curves in the spine that are supposed to be there, and when you adjust face down, you're flattening out the thoracic spine. Guess what follows? The neck and the lower back. This is just basic stuff. So we shouldn't be adjusting kids face down. We shouldn't be adjusting parents face down. I don't adjust people face down. You always protect those curves. That's the number one thing, but that's what you see constantly on there. So, the curve should be the number one focus in the spine because it's the most important factor of the spine. You wouldn't look at a heart, as I talked to medical students one time over at USA, you don't look at a heart and see a big blown out chamber of the heart and say, oh yeah, that's normal. That's completely normal. No problem. Yep, that's still a heart. because it's got 4 chambers. You know, so you don't look at a spine and say, oh, that's normal because it's still got the same number of vertebrae, even though it's completely straight or shaped like a candy cane. You don't do that. It's that you have to have those 3 curves in the spine, period. So, you know, we can make those worse if we're not paying attention to it. That's why a term came out, you know, called military neck, and that seemed to be somewhat associated with people going regularly to a chiropractor. They would end up with military neck because of all the mashing down on the thoracic spine, flattening out the neck. So this is an issue. This is a big issue. But, you know, of course, until standards change in education, that's not going to change either. But there's lots of studies available at icpa4kids.org talking about ear infections. So we need, you know, if you're interested in the studies, there's probably more research on kids and ear infections than any other topic in chiropractic, because it's just like black and white, okay? So to say there's no research behind chiropractic, anybody that says that is not evidence-based, they don't have a clue what they're talking about. I mean, just it's that they have not looked for any research. That's what it comes down to. People say stuff like that. I'm just like, all right, Richard. I'm sure he's probably trolling right now. So everybody's laughing. They all know what I'm talking about. Okay, so silver. We found that typically a single drop in each ear 1 to 2 times a day will clear most infections when there actually is an ear infection, okay? I had one time I had an actual ear infection, okay? I'm telling you, there's very few that really have been, but we call them when they are. This kid, I put the otoscope in his ear, you know, using this, and I'm looking around, and I can't see nothing. And I'm looking around, and I'm like, gosh, like, I mean, am I in wax or what? And so I started pulling back out, and as I drew back out, I realized what I was seeing was the inside of his ear was, he had blisters in there, and the blisters were actually kind of like pillowed on top of each other. And so I would, you know, and he was squinting as I was doing it, you know, obviously it hurt. And, you know, but he had these blisters that were kind of closing off his ear. That was an ear infection. But even with that, had them put a single drop in, I think 3 times a day in either ear. So you lay them down on their side, you put 1 single drop, and just let them sit there for about 30 seconds, okay? And then you have them flip over, and you put 1 drop in that side, and you let them lay there for about 60 seconds, and then you get up and go play, okay? And that was enough that within like 3 or 4 days, it completely cleared. Like, I looked at him again, she brought him back in, nothing. I mean, it was back to pretty much normal. Incredible. So here's how it works. Silver ions, which flow from the silver nanoparticles when oxidized, they're deadly to bacteria. Okay, so it's the ions that make the difference. But this is really, really cool. Research has shown apart from direct bacterial kills, okay, so the silver comes in contact with the bacteria and kills it right there, which you can see video. There's videos on YouTube where you can see bacteria swimming on the slide, and it comes in contact with the silver ion, and then it just slows down, and it just goes, and it just melts. I mean, it's incredible. The thing literally lyses and explodes. But there's also a zombie effect that they found in the research here. I've got the link here, where even dead cells are now deadly to other cells still living. And the reason why is, as you can see here in this picture, the silver ions, the silver nanoparticles, actually get absorbed by the bacteria. The bacteria goes and it comes in contact, and it actually absorbs these things into it. And so even though it kills that cell, now other bacteria that come in contact with that bacteria, they're now affected by the silver inside that bacteria, and they too die. So they die, they kill even when they're dead, right? It's pretty cool. So, you know, this stuff works. And the bottom line is, you know, what I want to get to here is, how often do you think you should run into a situation if 80% of ear infections clear on their own without doing anything, and then you've got something as simple as putting a drop of silver in the ear that's going to clear most of the other infections? How often do you really think we're going to hit those situations where it is rational to give a child a systemic antibiotic? oral antibiotics. I mean, think about what actually has to happen there. You take an oral antibiotic, that has to go into your system, circulate through your entire body, and get delivered through those microcapillary beds directly to the area in the ear for it to even work, right? For it to even do anything. Whereas you can put a drop of silver right there, and it's right there. I mean, it's too cheap. It's too cheap. It's not $350, folks. I don't know how much does a bottle of silver cost. I mean, you can get a little dropper bottle for like $6, $8, something like that. So yeah, it's too cheap. It's not $350 a visit. So anyhow, any questions before we close that out then? Yes.
You explained to me about the, because I know with my friends, a lot of them, can't imagine letting a chiropractor, adjust the neck. That just seems really violent. And that's how I was in the beginning. And you compared it to, birth, the forceps and stuff like that, and birth and the different pressure.
Not compared to, Lord, that. Okay, so what she's referring to is during birth, they've done studies that looked at how much force is actually used to pull a baby from the womb. Okay, and the doctor was Dr. Gottfried, I think. I've got it somewhere, but what they found is that the average force used when they use forceps or a vacuum to pull a baby out was somewhere in the vicinity of 110 to 130 pounds of force. Okay, that's if you can imagine that. Okay, that would be like me holding up your newborn baby that just came out of the womb by its head, and then saying, Amber, can you come over here and grab onto its legs? Okay, good. Now lift your legs up off the ground and hang from the baby. That's how much force is being used. Okay, so, but even in a natural birth, they're still grabbing the head and giving some degree of pulling. Okay, in an actual chiropractic adjustment done right, your kid is doing more movement of his head when he's turning to look who's behind him. I mean, it's just as simple as that. There's most of the kids, like I just baby tonight, and she's 6 months old, and sitting there the entire time just looking at me, as I'm massaging her neck, the adjustment, they're just sitting there looking at their mom and smiling, and it's not a traumatic thing. It's a joke to even think that it would be a traumatic thing, but it comes down to that. They've never seen it. So anybody that says they can't imagine, it's just because they've never seen it. But we see the same thing with adults. We have adults come in all the time and they're nervous to get adjusted, and then they get adjusted and they're like, oh my God, that was it? And I'm like, yep, that's what you were nervous about. And they're like, oh my gosh, geez. Yeah. So yeah, it's mind blowing that somebody wouldn't try that first. It's mind blowing, especially going to the point of ear tubes and putting your kid to sleep, or even worse than that, before getting adjusted. I can't even imagine. Did that answer your question?
Yeah, I remember.
Okay. Okay. Any other questions? If anybody on Facebook or YouTube has any questions, any real questions, you can of course leave. You can leave them in the comments. If you just want to write on chiropractic for no reason, then you might get humored, but probably not. If there's any questions that you have individually, you can always, of course, message me directly, and I'd be more than happy to help you. But the obviously there's this is not a topic where it's like you're just trying to sell something a different. No, it's not. I mean, we don't do. I mean, ear infections aren't something that I see every single day. It's not something that we have people calling in. Oh, my kid's got an ear infection. Can I bring him in to get adjusted? That doesn't happen very often. It's simply the fact that I see this stuff happen all the time, and I hear about it, and I see it on Facebook and stuff like that all the time. And it aggravates me to know that this is going on without any second thought of, is this really necessary? So until we educate people further on what is actually going on, we're just going to continue to repeat the same things. So if you have any questions, by all means, ask away. There's nothing to be sold. It's just a matter of, is treatment necessary or not? All right. Have a great night. If you have any questions, let me know. But otherwise, adios.